Youth Healthcare Prevention, Promotion, and Educational Fair in Southeast Washington, D.C. The kids in our community need guidance. Every year, more young girls are getting pregnant, the STD and HIV rates are increasing dramatically, and these kids do not eat properly, causing a lot of people in our community to suffer from obesity. They need to be taught how to live a healthier lifestyle. No wonder African Americans are dying at an earlier age than any other racial or ethnic group. If they knew better about their health, they would. Martha Jones, a resident of Southeast Washington, D.C. The mission of this project is a community improvement effort that will implement a healthcare prevention and promotion fair at a school in Southeast Washington, D.C. This healthcare fair will provide students of this underserved community with the educational resources and materials necessary to help them lead healthier and longer lives and reduce sexually transmitted disease rate in their community. When I had to consult an expert in order to estimate the sources of data and estimate the time for this project, I picked Jane Kirchner, who's a community-based learning coordinator at the Center for Social Justice. She completed a similar project 2 years ago with 5 after-school kid staff members and 15 Georgetown students. When I asked her for several estimates, she decided to give me, to complete the PERT analysis, she gave me an optimistic estimate of 3 months, a realistic estimate of 6 months, and a pessimistic estimate of 8 months. Information, I was able to calculate the expected duration of 5.83 months. Well, why is 5.83 months a reasonable time to implement a healthcare field at a high school? Well, she decided for each of them, it depended on my team members, their experience, and the school board. First, I might not have enough people to dedicate to the project. They might not have enough time because they are Georgetown students who are required only to dedicate 20 hours as opposed to her students which are able to dedicate 30. My team members may have little experience in implementing community events, which was the same as hers. However, she did have staff members who were professionals in creating and implementing community events. And it also depends heavily on the cooperativeness of the school board. If they cooperate, then this project will go by pretty fast. But if they don't, it can delay this process, causing it to last for 8 months. Well, what is our work breakdown? In order to make a community improvement action, we first need to assess the health needs of our community. We selected a needs assessment tool, printed the survey tool, and selected a list of health professionals in the Southeast area. We made a sample from that list and then mailed surveys. We gave them 30 days to respond, and we collected the responses after 30 days and analyzed this data. We had to analyze this data based on the collective responses so we knew what healthcare issues was plaguing the Southeast community. Now, at the same time, what we were doing was recruiting team members. We created a volunteer application, printed it, and selected a list of community leaders to hand it out to. We mailed the applications, and we collected them 30 days later. After we collected the applications, we were able to interview applicants, and after interviewing them, we reviewed their application. After reviewing the application, we made a decision and contacted the chosen applicants. Now that we have recruited a team, now the next task is dependent on that, which is the team training session. To start training, you have to configure the system. We purchased the system, then configured it. Then we had training. We purchased the training materials such as pens and papers to facilitate learning, and then we detailed employees. Now, after task 17, which was after the team recruitment, I decided to start planning the venue. The venue will be where we will hold the healthcare fields. I reserved the venue by searching different areas for 7 days, and I reserved it. Then I designed the facility and how we're going to set the healthcare field based off the venue that we reserved. Then, based off how we were going to design the project, I then rented furniture. Next, now that we knew where our venue was, we would then have the next task, which is advertisement. Advertisement is dependent on the completion of venue planning. Now, with advertisement, we had to purchase materials and then create flyers and poster boards and then distribute them. Next, we have educational resource management. This was dependent after we found out the healthcare needs of our assessment. Now, in order to do this, we created a list of healthcare professional organizations that we would like samples from. And these professional organizations would be the health places where they specify the healthcare needs of the community. We contacted the organizations and then gave them 30 days to deliver samples. After that 30 days, we then created education materials and printed the education materials that will be given out at the fair. Now, after we had the venue set up and we rented the furniture, in task 23, after we trained all the employees, we were then able to set up the fair. We had the furniture delivered 3 days later, set up the furniture, and then we were able to decorate the venue, therefore giving us the opportunity to hold a healthcare fair. Now, this is our Gantt chart that shows us what I've just explained in our work breakdown structure, and they show the interrelatedness. The critical path. That was also our critical path because there was no slack in this project. The estimated start date was January 1st, 2008, and the estimated end date was June 23rd, 2008, which would be the date of the fair. Now, our communication plan. We have the school board, the sponsor group, and the third group, which was our team members. The school board, the sponsor group, which is composed of several Centers for Social Justice members. Now, in our communication plan, the sponsor receives status reports and executive summaries bi-weekly by email from the project manager. The project manager will also present a PowerPoint presentation, a media component, at meetings, which will be a verbal report. Now, the project manager will receive status reports daily by email from team members, and the school board will receive status reports and executive summary and a PowerPoint presentation every month, but the status reports and executive summary will be emailed, and the PowerPoint presentation will be a verbal report at a meeting. And the sponsors of the report are responsible for sending this to the school board. Now we have a scope management plan. If the scope of our project ever changes, this is what a team member should do. The team member should submit a request at any time during the project if they feel like anything needs to be changed. The project manager must ensure that this request has enough information and research about the request in order to make an informed decision. After the project manager reviews the request, they must evaluate the impact of the potential change on every aspect of the project after consulting with experts. This is step 1, which is called the change request. Next, we have step 2, which is the sponsor analysis. Now, the project manager, after reviewing and consulting with experts, they must present the completed review to the sponsors. The sponsors may sign off on the scope of the document. If they choose to reject it, then you have another chance to resubmit the document with making significant changes. We also have resource and quality management plans. The resource management is determining the resource needs for each activity. Each task will have resources assigned to it, roles and duties associated, and team members to fulfill these needs and budgets. So you have the resources, the roles, and the team members assigned to completing the task, and the budget allocated for the task. Now, in order to manage quality, we have to define the metric used to define success. At the beginning of each week, the project manager and team members will evaluate the completion of their work and their work ethic, if they think they did well and if they think that the task was successful. And this will happen every week. Now, how do we plan to address project risk? Plans to reduce risk and prevent disaster. First, we must identify risk. Then we have to determine the probability of its appearance, prioritize the risk, and then create potential mitigation strategies. For this project, several risks. After determining the risk and prioritizing them, one of the biggest risks is that the exhaustion of budget before the task is completed. In order to mitigate this, we will overestimate the budget for each task. Now we know team members, since they're Georgetown students, may not be able to dedicate 20 hours a week. Therefore, we will have makeup training sessions and provide students with the tasks they complete from home. And what if the healthcare organizations do not deliver resources samples? We can allocate funds to purchase samples from a medical supply company. With all this taken into account, this is my healthcare management, education, and promotion fair in Southeast Washington, D.C. for the youth in the neighborhood.